Hemiarthroplasty, partial shoulder replacement for avascular necrosis. Hemiarthroplasty is a specialized option for avascular necrosis where blood supply loss damages the humeral head, causing pain and instability. Surgery details. The hemiarthroplasty, the surgeon replaces the damaged humeral head with a new ball attached to a stem, preserving the healthy socket. Benefits. Targeted treatment. Addresses avascular necrosis by replacing the affected humeral head. Less invasive, offers a quicker recovery compared to a total shoulder replacement. Potential for improved stability. Preserving the socket may enhance shoulder joint stability. Candidate evaluation. Your surgeon will evaluate your condition and overall health to determine if hemiarthroplasty is the best option for you. Recovery. Wearing a sling post-surgery for support and protection. Physical therapy to regain strength and mobility. Improved pain relief and shoulder stability may be achieved. Hemiarthroplasty is an effective option for avascular necrosis, restoring shoulder function with targeted treatment. Your surgeon will assess your case to decide if this procedure is right for you, bringing you closer to a pain-free and stable shoulder joint.